So, hello everyone, and happy Sunday. We are back with Chatting with Charities, where we are chatting with island nonprofits and charities to find out what they do in the community and how islanders can help them do their good work. So, today I'm joined by Corinne, and she is from the PEI Alzheimer's Society, and she's going to tell us a little bit today about what they do and how we might be able to help. So, thank you for joining us. Very
Thank you,
happy to see
Carol.
you. It's nice to see you, even though it's not in person.
Yes.
Did you want to let us know a little bit about your organization and what it actually does?
So we actually exist to fulfill a mission to alleviate the personal and social consequences of Alzheimer's disease and also search for a cause and a cure. So just a really small mission.
Yeah,
um,
exactly.
it, yeah,
Yeah.
it can be very daunting at times. And as a small province, the research component isn't something that we can build a huge capacity for, but it's really, really important. And so we basically fulfill our mission under four pillars. We have research, we have advocacy, we have programs and services, and then we also fundraise and try to build capacity to be able to maintain the services that we're offering.
Okay. And so if people, like you said that you do fundraising, or if people would like to donate to the Alzheimer's Society, where exactly would the funding go? Like, what would you do with the money that you raise?
So there's definitely a percentage that goes directly to research. The Alzheimer's Society of PEI is connected to a federation of Alzheimer's societies. So we have an Alzheimer's Society research program specifically. And the main focus of that research program for us is really inviting those new doctoral students, individuals coming into the research field in neurological capacities, interested in neuro research. And so having them early and supporting and contributing to their work that might further finding a cure for Alzheimer's disease or finding a treatment option, or it could be things that make a difference in terms of quality of life research. And so that's where we focused our energy. And we work very collaboratively across many research sectors that would also be impacted by a disease of the brain, such as Alzheimer's. So this disease is 115 years old, and we have no cure. The last treatment, drug treatment, was 16 years ago. So we're way behind. But what we have done is focused on clinical trials. So we want to have people involved in research in helping to find a cure or a treatment or a drug. And we also invite people that are healthy, because you need to have the healthy population be part of that research capacity as well. And then our advocacy is really advocating for change, helping people find their voice, speaking to our elected officials in so many ways and capacities, and really talking about the importance of prevention, warning signs, thinking of our brain health. I think that's just so key. And often we truly do forget that. We don't pay as much attention to our brain health as we do to our physical health,
Hmm.
and our brain health is equally as important. And then I think the bulk of our work is really working with families, working with those that are diagnosed through our First Link program. We work with the care partners. So, not only those that may be a care partner to someone diagnosed, whether it's a spouse, an aunt, uncle, brother, sister, niece, nephew, we also work with healthcare professionals. So we actually have created a dementia care training program. And so all frontline healthcare professionals are trained in dementia care. And it's a very hands on program. And so those would be kind of the top areas that you would see your dollars going to. And we case manage and work with families from the point of diagnosis to end of life, basically.
Okay, and it's such important work. I know so many people are affected by Alzheimer's and dementia,
Yes.
um, and especially now that the awareness is out there that
Mhm.
that's actually what it is. I know years ago people wouldn't know what Alzheimer's or dementia was. So even just giving the people the education, the caregivers, and what it is and how you can care for them in the proper manner, I think is so, so, so important.
And it's still for our health charity. It very much is where we still are. We're not at a place where within the continuum of care and our health system that caregivers and people diagnosed are going to have the support. So it still very much is part of the role of the Alzheimer's Society in those first 13 years to be supporting individuals and helping them navigate the system of care until they're reaching a point of possibly looking at a long-term care placement. And to be clear, that isn't true for everyone. Not everyone with dementia is placed in long-term care. There's many wonderful people living in our communities. And even in terms of long-term care, if you look at the numbers, there's about 2,000. You still would see 80% of the individuals in long-term care on the continuum of some diagnosis from mild cognitive impairment to dementia. So it's quite prevalent out there. And you brought up a really good point about awareness because one of the things we invested in with donor dollars is looking at what is the baseline? How are we doing in terms of awareness on PEI? You
Right.
know, for me as a CEO, I've been in this capacity. This will be my 14th year. And so it was really trying to, yeah, okay, where are we at? How are we doing? And we're wanting to expand and build two more positions on the ground in the western and eastern ends of the province. We cover the whole province, but really having a presence there is key. But what we learned in that awareness survey, which was just released last week to Alzheimer's Society, PEI, is that 90% of the individuals surveyed actually are aware of the Alzheimer's Society, but anywhere from 38 to 60% did not know where to go for support.
Wow.
And so, what that tells me as a CEO is we really need to be investing and putting people on the ground in the communities to really get people to the education and support and services that are needed.
Yeah. Yeah. That's so, so, so important.
Yeah.
So if somebody wanted to make a donation, or if maybe they didn't have the financial means to make a donation to your organization, how could they, well, first of all, how could they donate financially? Is there an easy way to do that? And if they don't have the means financially, what else could they do?
We could not do what we do without volunteers and donor donations. So we actually at our website on the left side, you'll see a donate now button, which is the easiest way to make a donation online. But you can also call our office. So simply call our phone number or email us at society@alzpei.ca or 628-2257. And basically, from that point, we receive whatever people, how they want to donate. And we've had individuals donate gifts of shares or securities as well. So we have the capacity for all of those things. And we're so grateful to our donors. And our volunteers, we have volunteers from many walks of life. So we've had people volunteer to be a companion to someone. So supporting someone on their journey and being a friend to them, basically. We have individuals who help us create our information packages. So we work with a wonderful organization, Stars for Life, where residents, their part of their workday is actually supporting the Alzheimer's Society and helping us by creating information packages, as one example. They may also do data entry of surveys that we've done to be able to put in an Excel spreadsheet for meaningful analytics. And then when you see, when an individual comes to us with a professional background in social work or teaching and is retired and wanting to contribute time, we can easily find an opportunity to invite them to co-facilitate an information session or Dementia 101 PowerPoint presentation. So we welcome all volunteers, and it's an easy process. We actually have a volunteer application form on our website for people to complete, and yeah.
That's awesome. That's a lot of opportunities. And you know, I've had people contact me and, say, I really want to volunteer, and where can I go to volunteer? And it's so good to get that information out there, because
Yes.
I think people often think of, donating funds, but there's so many other ways that you can donate. Your time is just as valuable. So
Invaluable.
yes, I think that's
Yes.
really important.
Very.
Well, I think that's all the questions that I have. Is there anything else that you would like to add that you'd like people to know?
I think I guess my key takeaway from you reaching out and giving us this opportunity is that we're reaching another audience
Yes.
of people that may not be as familiar with our work of the Alzheimer's Society. And I'm just so grateful to that. COVID has certainly put a very different lens on our work for us. We're a small team of 3 with 2 of us working frontline, and we have approximately 700 families that we're working with. And we've had a 300% increase in people reaching out to the Alzheimer's Society for information and support in the past 8 months. So it's a very daunting world out there, and people are really needing the support. And we welcome the audience that you're reaching to certainly reach out to us for opportunities to volunteer or support us. And I'm grateful, very grateful, Carol. Thank you.
Well, that's good. And that's the whole premise behind this,
Yeah.
that we hope that we can help you reach new people and continue to do your good work. And we appreciate that. We really, I think I can speak from all of the people that are touched by this, that it's very, very important work.
Thank you. We're very passionate about it.
Yes, and I know that. I witnessed that. I'm well aware of that. So that will wrap up today's. And in the comments, we will have your website and how to get in touch with you. And we'll post this on social media so people can see it and hopefully reach out to you. And we wish you the best. We hope that COVID goes away soon, and that maybe I'll get to see you face to face sometime soon. That would be great.
That would be wonderful, Carol. Thank you again.
Okay, and thanks everyone for watching, and we will see you next week. Okay, happy Sunday.